Okay, Dr. Deuk Majan, I'm here with my patient who just had basically a history-making surgery. Now, you all know that Duke Spine Institute specializes in endoscopic spine surgery, and in the lumbar spine it's transforaminal. This patient, if you don't mind me saying, we've already fixed his neck and his lower back with laser surgery. Now he came to me with 3 herniated discs in the thoracic spine, T10-L1, T11-12, T12-L1. And we tried everything to fix those, the pain that was coming from those herniations. But nothing worked. We did shots, medication, therapy, time, even stem cells, right?
Yep.
Nothing worked.
Nothing.
And you still had that same pain right in your thoracic area.
I did.
The MRI showed some small disc herniation. We call them disc bulges. That was the only thing that was there that could be causing his pain. So what did you tell me?
I can't take it anymore. Will you help me?
I can't take it anymore, will you help me? That's exactly what he said. And I said, what? What were your options?
I did infusion was one of them.
Yep.
Continue to stay in pain was another one.
Continue to stay in pain.
Or you would
Try the laser
by the
surgery.
grace of God, try laser surgery.
And that's what we did today.
That's what we did today.
So you are now 30 minutes coming out of the operating room. You have
Less than that.
Yeah, you have no pain medication in
Nope.
your system other than what you normally take.
Right.
And what can you tell me about the pain that you came here for?
That my pain is reduced at least by over 50% from what we did today.
Yep. So the area in his thoracic spine that he had horrible pain that we couldn't get rid of with anything else, it's gone down by at least 50%. And this is just 30 minutes after surgery.
30 minutes in, yeah, I can already tell a difference. I can already tell a difference.
So you've had the very first 3-level thoracic Deuk laser disc repair ever performed.
That's kind of crazy.
It is crazy. And I told you before that I've only done 2 other thoracic
Yeah,
Deuk laser disc repairs.
that's right.
So you're the 3rd patient, and the other 2 were single levels. You had 3 done.
Yes,
And we did it, and everything went perfect.
that's great.
So, congratulations.
God bless you, thank you.
You're welcome. I'll see you tomorrow.
I'll be here.
All right. Take it easy today.
I will.
All right.